Welcome to the training Introduction to Health Literacy. This training module explains what health literacy is and how low health literacy affects all of us. It describes the need to use universal health literacy precautions with all your clients, and it offers your organization 4 key practices to help you become health literacy friendly. So, what is health literacy? How would you define it? Well, health literacy is defined as the degree to which people have the capacity to access, understand, and act on information to make appropriate health decisions. But what does that actually mean? That means, can people find information? Do they know what it says? Can they take the actions recommended to have better health? This short video from the American Medical Association explains health literacy.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess the doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay. So
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, Okay.
But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on a chair or something like that, something different.
Just being hypered,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign, never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
So health literacy is more than just how well someone reads. It also includes listening skills. It includes understanding numbers and being able to write. Also being able to find reliable information on the internet, and then knowing how to analyze that information in order to make decisions. And a person experiencing low health literacy might struggle in one or all of these areas. So just for a moment, let's imagine you're taking your young child to the doctor because he has a stomach ache and diarrhea. So the doctor asks you a lot of questions and then says your child probably has an enteric illness and hands you a piece of paper. Well, first of all, you don't probably know what enteric illness means. And second, your reading skills may not be very strong. Would you be able to follow these instructions? Well, probably not, because these are actually instructions for how to wash your hands written in Somali. But for someone experiencing low health literacy, this English version may be just as difficult to understand. So what happens when a patient doesn't understand what the doctor said and isn't able to follow the written instructions? Well, you might see a lack of compliance, so maybe the family continues with poor hand washing. You would be likely to see the disease spread, so others in the family might also get sick, or the child may take the illness to school or daycare and other kids there might get sick. The child might also get sicker, which would lead to poor health outcomes, and he may even have to go back to the doctor or be hospitalized, which would increase the healthcare costs. And the family is probably less likely to seek medical care in the future if they felt embarrassed or stupid or thought that the doctor just really didn't help them. So these are all the costs of low health literacy, and all of these impacts can be prevented with better communication that fit the patient's health literacy level. So let's talk about some other costs of low health literacy. The National Pharmaceutical Council reports that 7 out of 10 consumers fail to follow medication prescription instructions, which costs the pharmaceutical industry $15 to $20 billion a year. 18,000 elderly outpatients die or are seriously injured by prescribed medications each year, and about half of those deaths are preventable. And 7,000 patients die from drug errors every year. Low health literacy increases U.S. healthcare costs by $50 to $73 billion a year. And annual healthcare costs for people with low health literacy skills are 4 times higher for those with higher literacy skills. Your organization sees clients every day who are experiencing low health literacy. Who are they? Does this person have low health literacy? This one? Or this one? How about this one? You really can't tell, can you? When a client walks in your door, you have no way to really know what their health literacy level is. Some people may be more likely to experience low health literacy though, and this might include older adults or racial and ethnic minorities, people with lower education levels or people with lower income levels, and also non-native English speakers or people with health conditions. But again, you can't tell who has low health literacy just by looking at them, and you should never assume to know someone's literacy level. Many people experiencing low health literacy will hide it because they feel shame, and they may pretend they understand what you're saying. They may even try to fill out the forms or make excuses. So here are some red flags that might help to indicate a person is experiencing low health literacy. You might see them filling out forms incompletely or inaccurately. They might frequently miss appointments. They might fail to follow through with lab tests or referrals. They might not be able to name all of their medications or even tell you when they're supposed to take them. They might say they're taking their medication, but really there's no change in their health. Or they might say they forgot their glasses, or they'll read their documents when they get home, or if they're really brave, they may even ask you to read the documents to them. But even with these red flags to watch for, you really still cannot tell when a person's experiencing low health literacy just by looking at them. In fact, according to the U.S. Department of Health and Human Services, 9 out of 10 of us don't have the literacy skills we need to manage the demands of our own healthcare system. So low health literacy means that a person has difficulty accessing, understanding, and acting on health information. And it's not just based on a person's reading skill or their education or income. Low literacy can affect all of us. And at certain times, our literacy skills can drop even lower, such as when we're worried or we're uncomfortable or feeling vulnerable, like when you go in for your annual PAP or mammogram, or go in for a cancer screening. So since you can't look at a person and determine if they are experiencing low health literacy, it's very important to use the same health literacy friendly principles and practices with everyone. Everyone benefits from clear communication and plain language about their health, and we call this health literacy universal precautions. Just like medical healthcare professionals use universal precautions, like wearing gloves or personal protective equipment with all patients, regardless of what their chief complaint is, you should use the same universal health literacy precautions with all clients, regardless of what you think their health literacy level might be. So health literacy universal precautions means you provide accessible, understandable, and actionable information to all patients, regardless of their health literacy level. For example, instead of giving them the text version of the hand washing instructions shown earlier, you could use this picture-based version as an educational tool. Do you think someone experiencing low health literacy might have a better chance of understanding these instructions? This example uses simple text, pictures, and numbered steps to make the information more clear. So the first change your organization can make to implement universal health literacy precautions and become more health literacy friendly is to use written materials that are simple and incorporate pictures, like the hand washing information page. But you can't just depend on written documents alone to provide information to your clients. You need to engage all adult learning styles. Some people learn by reading, but others learn by listening, and still others learn by watching or by just trying it themselves. When someone gets a new smartphone or a camera, they might sit down and read the instruction manual cover to cover. Someone else might watch a YouTube video that explains how the camera or smartphone works, and others may just open the box and start pushing buttons. So you don't necessarily know how your client is going to learn best. And in order to make sure you engage all learning styles, you need to tell them, show them, demonstrate, and then let them try. People receive information and learn in different ways, so tell them using plain language, show them using the chunk and check method we're going to talk about to highlight key points on a written document. Demonstrate it for them using visual cues and let them hold items as you talk about them. And then let them try it themselves. Ask them to demonstrate back to you what they've learned. So the second change you can make to ensure your organization becomes more health literacy friendly is to engage all learning styles. When you communicate with clients, be sure your communication is clear so it will have the best chance of being understood. If you tell your client to come back tomorrow for a makeup appointment, what will she expect? Will she bring her lipstick and eyeliner? If you tell a client in your waiting room that your staff member is running behind schedule and will call him back later, what will he hear you say? Will he sit in the waiting room waiting to be called to the back? Or will he go home and wait to be called back on his phone at a later time? Now, these misunderstandings may sound silly, but they have actually happened. Remember, communication that is not clear can lead to misunderstandings, mistakes, lack of compliance, and poor health outcomes. So the third change you can make to ensure your organization is using universal health literacy precautions and becoming more health literacy friendly is to improve your communication with clients. Let's talk about 3 ways to improve your communication. First, use plain language, including not using jargon and keeping your language simple. Jargon is the language you use in your field that is widely understood by your coworkers, but not necessarily by others. Here are some examples of jargon used in healthcare. Read these sentences and see if you can restate them in plain language. You've suffered a contusion to the soft tissue below the 4th thoracic vertebra, exacerbating the proximal sternum. In plain language, you have a bruised rib. Limiting your sodium intake will reduce your risk of hypertension and cardiovascular disease. In plain language, eat less salt to lower your risk of high blood pressure and heart disease. Keep it simple. Speak slowly and clearly, and use words that have less than 3 syllables. Here are some examples of how to keep language simple. For example, instead of saying cardiovascular, say heart. How could you rewrite the rest of these words into more simple language? Also, use action-oriented statements that are interactive and answer the question for the client, what should I do? Instead of saying lifestyle modifications are essential, make it action-oriented. Change the way you live. Instead of saying healthcare providers recommend you limit sodium intake, say eat less salt. Try this one. How can you simplify this sentence and make it action-oriented? Both patient and provider should refrain from talking during a blood pressure reading. How about, please sit quietly while I take your blood pressure? Let's try another one. Adopting a healthy lifestyle is critical for the prevention of hypertension. How could you make that more simple, using action-oriented words and avoiding jargon? How about this example? To keep your blood pressure healthy, you need to make healthy choices. Another way to improve your communication is to use the chunk and check method. The chunk and check method breaks down complex information into digestible chunks by using subheadings to navigate a lengthy document and highlighting 3 key points for the client to learn. So you can see here that we have a fact sheet from the American Heart Association. Now this is already written pretty well at a low health literacy level, but there's still a lot of text. You can simplify this even further for your client by chunking it into pieces and then checking for understanding. So start by asking the client what they know about the topic. This gives you a better understanding of what you might need to clarify and what new pieces of information would be most helpful to the client. Then prepare the client for learning. You can say something like, today we are going to talk about 3 important things you should know about your blood pressure. Highlight the 3 key points in the document as you list them. So today we're going to talk about what high blood pressure is, how it can increase your risk for stroke, and who is at high risk for high blood pressure. Then go back and provide education on the first point. What is high blood pressure? Check for understanding by asking an open-ended question. For example, so based on what we've just covered, how would you describe high blood pressure? Review points 1 and 2, and then provide education on point 3, and again, check for understanding. Finally, summarize the 3 key points at the end of the session. You can say something like, so high blood pressure means that the force of the blood pushing against the sides of your arteries is too high. This can damage your arteries and organs and can lead to a stroke. So it's up to you to control your blood pressure. Then check for understanding by using open-ended questions. You could say, so how would you describe high blood pressure? How does high blood pressure affect your body? And how would you rate your risk for high blood pressure? Finally, encourage the client to take an action to cement learning. You might say something like, today we've talked about what high blood pressure is and how it can lead to a stroke. We've talked about your risk for high blood pressure and some steps you can take to keep your blood pressure healthy. Which of these steps do you want to work on first? What goal would you like to set for yourself? So to chunk and check, use the subheadings of a written document and highlight the 3 key points you will talk about. Break down complicated information into manageable chunks for a person who is experiencing low health literacy. Check for understanding after each point by asking an open-ended question, and then check again at the end of your session. Now, the third way you can improve your communication is by using visual cues. Some people need to see a demonstration to learn best, and others need to actually touch an object or handle it to learn. So when you talk to a client about nutrition or portion sizes, don't just tell them to eat 1 serving of meat. Show them a picture of 1 serving of meat compared to the size of a checkbook. Or even better, let them hold the checkbook and look at its size as you talk. This way their brain associates 1 serving of meat with the item in their hand. So we've talked about 3 key concepts to make sure you are using universal health literacy precautions that will make your organization more health literacy friendly. And these 3 key concepts are: use written materials that are picture-based and easy to understand, engage all learning styles, and improve your communication by using simple language, the chunk and check method, and visual cues. Finally, we're going to talk about one more way to make your organization more health literacy friendly. The 4th change you can make is to ensure your organization is more health literacy friendly by demonstrating, observing, and verifying understanding. This can be accomplished using the teach-back method. The teach-back method encourages your client to teach back to you what she has learned. So if you want your client to monitor her blood pressure at home, you need to explain it to her while showing her the printed instructions, demonstrate for her how to do it, and then let her try it. Remember, tell, show, demonstrate, and let her try. As she's trying it herself, she can explain what she's doing. She can teach it back to you. This teach-back strategy helps you to gauge her level of understanding. You can observe and you can offer corrections as needed. You might say something like, "Today we've talked about how you can take your own blood pressure at home. I want to be sure that I was clear in my explanation. Would you explain and show me how you will take your blood pressure when you get home so I can be sure the information I provided was clear?" Now let's watch a short video of the teach-back method being used with a patient in the emergency room. This video from the Truman Medical Center shows a conversation between an emergency room doctor and a patient with difficulty breathing due to heart disease. Watch how the doctor uses the teach-back method to check for understanding.
All right, Chris, so you came in today for an urgent care visit because you're feeling more short of air. And after examining you and looking at everything, you feel like the shortness of air is probably because your heart failure is a little bit worse. Today is Monday. Our plan is to help with the shortness of air and to help with your heart failure. I want you to double one of your medications. So you told me that you've been taking Lasix 20 milligrams every day. I want you to start taking 40 milligrams a day. So you're going to take 2 tablets every day. And then you're going to take that every day for the rest of this week. And I want you to come back on Friday and see me again. The reason that I'm doubling the Lasix is because the Lasix helps pull the fluid out of your body. I think the fluid is what's making you feel short of air, and the Lasix will make you pee more frequently. And I think that will help with the shortness of air. Now you are pretty short of air. Your weight is up a lot, and so you are sick. I am concerned that if things get worse, you might need to get admitted to the hospital. So if you start having chest pain, worsening shortness of air, or if your weight goes up, I want you to either give us a call or come to the emergency room because I want to know that's going on. Okay? So I just threw a whole bunch of information at you. Can you explain back to me what the plan is and what we're going to do this week for your shortness of air?
So, because I've been having more trouble breathing, you think it's because of my heart, and so we're gonna double one of the medications I'm already taking.
Yep.
And if it makes me start to need to go to the bathroom more, I'm supposed to go to the emergency room and then call you guys.
So actually, we expect the medication to make you pee more. So that's how it works. That's how it gets the fluid out of your body. So we want it to make you pee more. But if you start feeling worse, if you get shortness of air or chest pain, those would be reasons to go to the emergency room. Okay. And I want to make sure that I did a good. I don't know if I mentioned what the name of the medicine was. So do you know which of your pills it is that you should be taking 2 of?
So I'm supposed to be doubling, taking 2 of my Lasix.
Exactly, perfect.
And it's probably gonna make me need to go to the bathroom more. And then if I start to have like chest pains or like it hurts here, or if I'm the breathing, if my shortness of breath gets worse, then I'm supposed to go to the emergency room.
Exactly.
And then I'm supposed to come see you on Friday.
Right.
Okay.
And we'll check up and see how everything's doing. What other questions do you have?
I think that's it. Are you guys gonna give me like this information?
Yeah, I'll give you some patient education about heart failure and things to look for, and put it with your DPART information. All right.
Okay.
All right. Well, it's good seeing you today. I'll see you
Thank you.
again. All right. Thanks.
So what did the provider do well, and what could she have done better? Well, she used plain language, she spoke clearly, and she repeated key information. She said she was going to double one of his medicines, and then explained that the dosage would go from 20 milligrams a day to 40 milligrams a day. She then told him to take 2 tablets instead of 1. She basically repeated her instructions 3 times using different words. So give an example of how the provider used simple language. Instead of saying difficulty breathing or shortness of breath, she said short of air. In another part of the example, instead of telling the patient the medication would cause frequent urination, she said it would make him pee more often. Now, what was the patient's misunderstanding about his medication? And how was the provider able to catch that and correct the mistake using the teach-back method? So by using the teach-back method, she was able to discover that he thought if he was peeing more often, he should go to the emergency room. And she was able to clarify that, in fact, the medicine should make him pee more often, because that would be a sign that the medicine was actually working. She was able to improve communication and understanding, and then the client was better able to understand how to take his medicine correctly and how to know if his medication was actually working. The teach-back method is not just for doctors and nurses to use. It should actually be used by all of the staff in your organization. Remember, universal health literacy precautions should be used with every client. So let's watch an example of the teach-back method being used by a receptionist as she schedules an appointment with a client. Now, first, she's going to demonstrate booking the appointment without using the teach-back method. And then she will do it again using the teach-back method. So pay attention to the differences in her style and also in the client's reactions.
Good afternoon, Community Healthcare Network, Cabs Health Center. This is Gina speaking. How may I help you?
Hi, I want to get a physical.
Sure, I can help you with that. Have you been to our center before?
I was there with a friend, but I didn't see a doctor.
Okay, what's your first and last name?
Maria Diaz.
Thank you, Miss Diaz. Is that spelled D-I-A-Z?
Yes, it is.
Okay, I just have to ask you a few questions to help you set up your first appointment. What is your date of birth?
It's October 11th, 1989.
And your address?
999 Blake Avenue, apartment 4A in Brooklyn.
Okay, great. And your zip code?
11208.
Thanks, Miss Diaz. Now, could you tell me your telephone number?
Sure, it's 718-555-4567.
And do you have insurance?
I do. I have Metro Plus. Do you guys take that one?
Yes, we do. All right, thanks for all of that information. The next appointment we have is with Dr. Summers on Tuesday the 13th at 10 a.m. The next appointment after that is on the 16th at 9:45 a.m. or 2:15 p.m.
Is that this month?
Yes.
Okay, I think the Tuesday would work better for me.
Okay, we can book that visit for you. Just a few things before you come in. Please call your insurance company and let them know that Rebecca Summers is now your PCP. And when you come in, bring all your necessary documentation, including insurance card, photo ID, and any prescriptions or medications you take. Please also bring your health records.
Great, I can do that.
Okay, so you're all set, Ms. Diaz. We'll call you in a couple of days for your appointment.
Okay, thanks. Bye.
Thanks for all that information. So I'm looking at our schedule, and the next appointment we have is next week with Dr. Rebecca Summers on Tuesday, August 13th at 10 a.m. Then the next appointment after that is on Friday, August 16th at 9:45 a.m. or 2:15 p.m.
I think the Tuesday works better for me.
Okay. Do you want me to schedule you for the 13th at 10 a.m.?
Yes, please.
Okay. And I'll schedule you for that appointment. Now, before you come in to see us, we ask that you call Metro Plus and let them know that you're going to start seeing Dr. Rebecca Summers and that she's going to be your primary care provider, or PCP.
Great, I can do that.
When you come in, please bring your Metro Plus card, photo ID, and any medicines that you take. Please also bring any papers that you have about your health, like past test results or x-rays.
Okay, great.
So, Ms. Diaz, you're all set. Before you hang up, though, I want to make sure I was clear in explaining what to do before your appointment and what you are to bring. What do you plan to bring to your appointment?
My health records and my ID and my insurance card.
Right. And also your medicines.
Great, yeah, I can bring those.
And when you call Metro Plus before you come in, you'll tell them?
That I am going to see Dr. What's her name again? I can write it down.
Dr. Rebecca Summers.
Great, and I'm going to tell them that she's my new primary care provider.
Okay, great. So you're all set for Tuesday, August 13th at 10 a.m. with Dr. Rebecca Summers. We'll give you a call 2 days before your visit to remind you.
Great. Do you have the number for Metro Plus?
I'm not sure what their number is, but if you look on the back of your card, there'll be a number there.
Okay, great.
Is there anything else I can help you with?
No, I think that's it.
Okay, then we'll see you on Tuesday, August 13th at 10 a.m. at Cabs Health Center. Have a good day.
Great, thanks. Bye.
So, what did the receptionist do better in the second example? How did she gauge the client's understanding? How many times did you see her repeating or hear her repeating the appointment information? And how do you think that the TeachBack method actually helped the client? Well, the receptionist did a good job in the second example of repeating information. She also asked open-ended questions to gauge the client's understanding. And because of that, she was able to fill in a couple of pieces of information the client had missed. And then finally, she summarized the information again twice more at the end of the call to make sure that the patient understood. So let's summarize the key concepts we've covered today. Everyone benefits when you use universal health literacy precautions with every client. So keep your communication simple. Use plain language, no jargon. Speak clearly with simple, action-oriented words. Use pictures or props to help engage all learning styles. Remember, tell them, show them, demonstrate, and then let them try. Break down complicated information into chunks by using subheadings and highlighting no more than 3 key points, and then check for understanding. And finally, use the TeachBack method to gauge your client's understanding and ensure that you communicated clearly. Studies show patients will forget half of what their doctor says before they even leave the exam room. And of the rest of the information that they do remember, they'll remember half of it wrong as well. Your clients are the same. To help them access, understand, and act on information that you provide, you have to use universal health literacy precautions with every client. It's your responsibility to make health information easier for your clients to understand and act on. Don't make it harder.
This is bad enough. This is bad enough, so please don't give me gobbledygook. Don't give me pages and dense pages and this leaflet aims to explain. Don't give me really dodgy photocopying and do not remove for reference only. Don't give me drafted in collaboration with the multidisciplinary stakeholder partnership consultation short life project working group. I mean, is this about you guys or me? This is hard enough, so please don't leave me oddly none the wiser or listening till my eyes are glazing over. Don't leave me wondering what on earth that was about, feeling like it's rude to ask or consenting to goodness knows what. Don't leave me lost in another language, adrift in bad translation. Don't leave me chucking it in the bin. Don't leave me leaving in the state I'm in. Don't leave me feeling even more clueless than I did before any of this happened. This is tough enough, so please make it relevant, understandable, or reasonably readable at least. Why not put in pictures or sketches or something to guide me through? I mean, how hard can it be for the people who are steeped in this stuff to keep it up to date? Do you know what I'd appreciate? A little time to take it in. A little time to show them at home. A little time to ask, what's that? A little time to talk on the phone. So give us the clarity right from the start. The contacts there at the end. Give us the info you know we need to know. Show us the facts, some figures, and don't forget our feelings, because this is bad and hard and tough enough, so please, speak like a human. Make it better, not worse.
Remember, you can't tell a person's health literacy level just by looking at them. We all have times when our health literacy level is low, so don't make things harder. Keep your language simple and check for understanding. It's your responsibility to close the gap of low health literacy and ensure your clients can access, understand, and act on important health information to make decisions about their health. It's your responsibility to become a health literacy friendly organization. You've just completed the training module, Introduction to Health Literacy. Type this link into your web browser or use the QR code to access the post-training quiz. For more information, visit deltamo.org.